I'm Dr. Abbay Vasavada from Ahmedabad, India. I am a practicing surgeon for 39 years, and I focus on the cataract management, the corneal management, and also at times the glaucoma. But primarily, I love cataracts and cataracts and cataracts. I run a Raghudeep Eye Hospital and Ila Devi Cataracts and IOL Research Center at Ahmedabad, and also in Jaipur, which is a little north in India.
Today we're here with Abbay Vasavada from Ahmedabad, India, who's one of the luminaries of Indian ophthalmology, who actually encouraged the development of cataract surgery as a specialty in India, and has taken a leading role in training physicians and developing new techniques across a wide range of procedures. And today we're going to talk a little bit about some of the recent innovations and new instruments that are improving the outcomes and quality of efficiency of cataract surgery. So, Doctor?
Thank you very much. I think we are witnessing a very positive evolution of the cataract surgery in terms of the diagnostic equipments, in terms of the surgical machinery. But the most important part, which the surgeon holds in the hands, are the surgical instrumentation and instruments of different kinds. And as the lens removal procedure is evolving with phaco machines, the flex assistants and so on, the instrumentations are improving and getting better and better. The innovations in these little details really make a significant difference in the performance of a surgeon. And I'm very happy that I'm associated with ASCRS for more than 2 decades. And the help and the assistance the ASCRS has provided not only to me but many surgeons across the globe is really commendable, and is very much. I mean, you take any instrument in the entire surgical procedure or armamentarium, and you will see nice, very well made instruments, durable and ergonomically so suitable to the surgeon that you really enjoy holding in your hands and applying for its appropriate application. So I think that is very important for everybody, for the industry, for the cataract surgeon, and for the practice and patients. So there are many innovations that have come up over the years, but of few I would like to stress is the Royal Injector that ASCRS has made. I believe is Dr. Akahoshi's innovation. And likewise, there are micro instruments for performing anterior capsular access, performing posterior capsular access, and also performing a descemetorrhexis in a corneal surgery. And these delicate but very durable, very predictable in the performance, these forceps, ASCRS has designed for me and for others that I really enjoy every time I perform a rhexis or an anterior capsule or posterior capsule. I'm so confident that with this forceps I'm going to fashion and achieve what I really aim at. So I think that this is a confidence-giving instrument, and which my junior colleagues also use it to the benefit. So I think these are the details which the ASCRS pays attention to is phenomenal. The one aspect of the lens removal which is not paid enough attention is to remove the epinucleus, but more so with the cortex or cortical material. And by manual cortex aspiration is a preferred technique in my hand, and I believe has more advantages than the coaxial aspiration. The bimanual irrigation aspiration allows the chamber to remain well formed all throughout the procedure, because the main valvular function of the main incision is not disturbed. It gives an easy access to the entire 360-degree capsular bag, and you can, in a very controlled fashion, complete the corticals removal so thoroughly that you leave behind very little fibers, and therefore your posterior capsular opacification will be remarkably reduced. And ASCRS has designed this wonderful irrigation handpiece and also the aspiration handpiece with appropriate fluid going into the eye and the right bore size, and the aspiration port located very cleverly near to the tip, that it really is a very easy procedure. It has become a very easy procedure. And the best part is that the unique design of this IA handpiece is such that it can easily pass through 1 millimeter incision paracentesis without distorting the small incisions. And remember, it is a distortion of the small incision which is a major risk factor for ingress of contaminants into the eye and resulting into inflammation and quite often endophthalmitis. So I think the well-designed eye handpieces makes that much of an impact in the outcome and reduces that risk factor. But effectively, it really is case after case, it works so well. And they resist the autoclaving process, and they are so durable. So whatever the metal they use, whatever the finish they do, it lasts and lasts and lasts forever. So I'm really very happy and enjoying. My trainees enjoy this and they love this. They always ask for, I want that IA handpiece or that capsular access forceps. So I think all these little things, addressing some details in the technicalities, makes a hell of a difference in overall performance.
Mm-hmm. I guess that's important for maintaining efficiency and reducing complications and so on.
I think this is, we all talk about efficiency, which is the primary goal, but also we need to make sure that every time you use it, safety and negative impact on the tissues are reduced to minimal, and that's where everything matters, and that's where I think ASCRS scores.
Great.
Right. So thank you very much.
Thank you. Anything else you'd like to add?
Thank you, ASCRS, for improving our life and reducing the stress when we operate, because if you're stressed, you can understand we can't put in our best. So this is one aspect where you guys have been very helpful. Thank you.
This is Dr. Abbay Vasavada on his experience with ASCRS instruments and on cataract surgery generally. Thanks very much for joining us.
Thank you very much. Thank you.